Well, IUI is the least invasive method so far, which is cost effective, cheap, easy to use. But there are certain prerequisites. Okay, so the first prerequisite is you must have at least one open fallopian tube, and the sperms must be at least one average quality. And even patients, the other things would be like unexplained infertility, mild endometriosis, even men having erectile dysfunction. They're able to masturbate, but they're unable to have intercourse. Then in those kind of scenarios, your IUI is a fantastic mode, is the method of choice. However, if they have severe endometriosis where their fallopian tubes have been infected, or blocked tubes, or where husbands have to undergo certain procedures like a MISA or TISA where to expirate the sperms from them, then those are the only cases where you need to do an IVF. Or some patients have tried the unexplained infertility, so they've tried chromate, they've tried the natural ways, unable to do it. They've even tried IUI. And if they have failed 2 or 3 times, then the best method is to go on to the next level, which is your IVF. Now, when you look at IVF, there are two methods of fertilizing the eggs. Firstly is your normal IVF, where we just pour the sperms around the egg, and the best sperm will fertilize the egg. However, men who have severe sperm abnormalities, okay, or history of poor fertilization in a prior IVF cycle, okay, even men who had to prior preserve their sperms, because we have some men who needed to freeze their sperms for multiple reasons, like logistics reasons. They cannot be at the clinic on the day of the IVF, or even have to had very poor sperm qualities, who had to give their samples multiple times and freeze. Now, frozen sperms, important that we do in ICSI. Even some cases where we do the sperm donation cycles, those also we end up doing the ICSI for them, because they do not have many sperms. So hence, we have a limited number of sperms. So it's important that we ensure fertilization takes place. So therefore, we do the ICSI for them. So those are the kind of scenarios where we do an IUI, where fallopian tubes unopened, at least average sperms, IVF failed everything else, your IUI and all, and ICSI, okay, where very bad sperm quality, or both IVF and ICSI if the fallopian tubes are blocked. And when it comes to age-related decline in fertility, most important thing I'll tell them to advise the couple to come and see you to conceive as soon as possible. And if the couples do not want to conceive as soon as possible, advise them, especially the women, to freeze their eggs for future use. Because nowadays we have very, very good methods to cryopreserve or freeze the oocytes, the eggs. So in this way, the woman can continue her life, her career pathway, and delay childbearing, but do not reduce her potential to have a child. Because as we know, as women gets older and older, they lose the best quality of eggs, and they lose lots of their eggs in the earlier age. So when they reach the age of 40, then their fertility potential tends to reduce markedly. So in general, I advise them to do it as soon as possible. And if they want to delay, cryopreserve. As for men, there's a lot of myths out there which says that age is only age affects women only. Well, not true. As I said, it's a myth, because men too, eventually as you get older and older, your quality of sperms too tend to reduce. And also things like erectile dysfunction. Okay? As you get older and older, you might not have a proper erection how you used to have in younger age. So age problem is both sides, not only the woman's side. It's both 50-50. The other thing would be, as you get older and older, if the patient still does not want to get a child, or they do not want to cryopreserve their eggs, then it's important that you advise them healthy lifestyle. As you get older and older, more affluent, you tend to eat more, right? Then you put on more weight. When you put on more weight, you risk of diabetes, hypertension, and lots of them, as they get older and older, start smoking and do unhealthy lifestyle changes. So in those kind of ways too, if they get if they are unhealthy, then the probability for eventually trying to get a child will definitely drop. Okay. The most important thing is that a healthy mother or healthy parents equals to a healthy baby. So if the parents are unhealthy, then there's a very high chance that they might not even able to conceive. They conceive, they may have a miscarriage. Okay, and even if they end up doing fertility treatments and they're unhealthy, obese, smoking away, then one thing for sure, their fertility treatment journey will be really, really difficult. Okay, so in short, when it comes to age-related, as soon as possible, cryopreserve and maintain a healthy lifestyle. So much so that do not get any chronic diseases as they get older and older. And the first people that who usually sees the patient will be the clinicians from the primary care. The primary care physicians are the most important people when it comes to for overall treatment for anything. So they're like a first line of defense. So the moment the patient sees them, I think the advice should start from them itself. And then subsequently from the obstetrician and gynecologist when the lady goes and visit them, and then eventually the fertility doctor. When we do an IVF, it's a lot of hormonal medication be given, and we need to ensure that the eggs grow properly. We need to ensure that the sperms are healthy. So all these are hormone related. Okay, and if the woman and man are healthy, you get healthy gametes, healthy egg, healthy sperm. So the first thing that we do is to assess them both in terms of any metabolic diseases, thyroid, prolactin, okay, the diabetes, testosterone, all these things are assessed. So because as you know, if you have an hypothyroidism, then the probability of the treatment failing is high. Okay. Not only that, they may have other immunologic causes which prevents them from conceiving. Like the other thing would be like prolactin, hypoprolactinemia. In men, it will shut down your sperm production. In women, you will not ovulate at all when your prolactins are very, very high. So it's important that these things be checked before you start. Now coming to diabetes. Now, if you have diabetes and your HbA1c is high, then there's more than 25% chances if that you may have an abnormal fetus. Okay, sacral agenesis, all this can occur in women with very uncontrolled diabetes. And then the risk of uncontrolled diabetes going to other end organ damage is very, very high. Okay, so hence metabolic diseases are something which need to be addressed first before we go on to the next step. So being in infertility, usually the cases are referred to us. So the good thing is that these patients will be seeing other doctors before they come to us. So most of the time, all these metabolic diseases are addressed before they see us. The other thing would be obesity. Obesity is something which is becoming very, very common nowadays. The problem with obesity is, number one, the doses of medication required for women to grow their eggs, okay, will be much higher because the doses depend on their body mass index. Higher amount of fat, the more doses of medicines that need to be given. So many times we see patients who are obese and advise them to please lose weight. Yes, it's easier said than done, that's for sure. But most importantly, we stop their sugars, reduce their calorie intake, start some form of exercise. Not necessarily work out in the gym or run around the gym, but just brisk walking. It's good enough because they tend to burn their calories and they prevent themselves from putting on more weight. Now that's important. The other thing is that they improve their cardio. Okay, their overall health improves. They're a bit less stressed because exercise is the best method. Okay, and for you to relieve stress. Okay, to be even more fresher at work the next day. Okay, so helps in your overall health. So it's important. So these women who eventually start losing weight, exercising, stop their sugars, reduce their calories, they even become healthier and healthier because what they do is they end up taking more care of their food. Okay, they end up taking more multivitamins like antioxidants, Your vitamin Ds are nowadays something very, very important, okay, for them to improve their oral pregnancy chances. And they start taking other things like folic acid, for example. So, yeah, so metabolic disease is something which need to be addressed at the first consult itself. So this is usually is easily checked because at the initial assessment, we generally do a general blood test for them to look for any medical problem or any endocrine problem that they have. So it's something which, yes, is very, very important. Oh, yes, I totally agree with you. Not only for women, but both men and women. Because we have many cases, examples, which have done IVF or any form of treatment many, many times. And we call it unexplained. Unexplained is basically, when we call a couple unexplained cause of infertility, is because we do not know the cause. So I feel that these genetic biomarkers are the next step that we can answer those questions as to why they are unable to conceive. An example is that if the woman or the couple has a genetic abnormality where they're unable to conceive, then we can tell them, look, the husband, for example, you have a genetic abnormality for which then you are unable to have your own genetic child, hence we can use a sperm donor instead. So we reduce their stress, reduce their time in terms of trying their best to get their genetic child. Well, I'm sure in future eventually this some of the genetic abnormalities can be treated, but I think for now not many. As for a women too, there are a lot of genetic tests which can be done. For example, there are many things like your FSH receptors, your zona pellucida 1. There's so many things that have been out there in the market, but there are so many tests. So which one you want to test? So end of the day, it's like a wild goose chase trying to test for every single thing. But of course, biomarkers are something which are important because it will narrow down the variability, the number of things that we need to treat. So if the woman has something which can be treated, good, or else use an egg donor. So I guess these genetic biomarkers are something which should be done for patients who are either unexplained, who have gone through like multiple IVF, ICSI, even pre-implantation genetic testing cycles and failed. They should get these things done. Well, aside from genetic biomarkers, there are other biomarkers which now are very, very, freely commonly used, like your anti-Mullerian hormone. I think when it comes to biomarkers, anti-Mullerian hormone is something which has helped us clinicians to determine the best dose of medication and also prognosis of a patient. Okay, biomarkers generally will help us to determine whether can they conceive, can they have a successful cycle or not. Well, I think it should. The only problem now, biomarkers, genetic biomarkers especially, are very, very costly. But I'm sure, just like other things in the market right now, it started off as expensive. Eventually, it can be, the masses can eventually use them for cheaper prices. Yes, biomarkers are something which should be made easily available for everybody, and it will definitely make our life easier as clinicians. Well, there are many diagnostic advantages that are needed, but so far in my clinical practice, there are two things which I felt that has improved mine, and I'm quite sure most of the doctors' success rate. Number one is your womb lining, because the womb lining is something which is very, very important. If you have the best womb lining, then you increase your implantation rate. So number one, we have to check the test for window of implantation. There's many tests that has come out now. It's called the endometrial receptivity analysis. Okay, the ERA test. Even now from Taiwan, they have something called the Mira Test, which checks the mRNA in the womb lining. Now, these tests will narrow down the window of implantation. So it's said that's increased the success rate by 72.5%. Okay, and it's actually, in my opinion, I think it's true. It does improve because many times the patients who have failed in IVF, a frozen transfer example, they do this test, and then we find that their window of implantation has been displaced. So and then the next cycle we follow the ERA timing or the Mira timing, and then that improves the overall pregnancy rate. But I feel that I think this endometrial receptivity test, I'm sure there's still a lot more to be done to improve the timing. Okay, so and improve their implantation rates. But overall, this is a very good test. The second thing would be like your pre-implantation genetic testing for any aneuploidies. These ones too has reduced the probability of a failure, because if you have, for example, you have 10 embryos and you're subjected to pre-implantation genetic testing, and suddenly you might find only one which is normal. So you save time, save money, save the woman a lot of stress of going through multiple failures, and straight away implant that particular embryo. So in some centers, the success rate is up to 70 to 80%. And you add the pre-implantation genetic testing with your with ERA, for example, your endometrial receptivity analysis, it improves even further, because as we all know, to have a pregnancy, you need a good euploid, a good quality embryo, and you need a perfect endometrial lining. So these two things are mandatory for us to improve the IVF success rates. So an ERA and PGT is something which is good. The second thing would be, as for the genetic testing of the embryo, I'm sure in future there will be more tests available. Now we have the new generation sequencing NGS machines which is out, and the other things would be your time lapse. Time lapse is something which has been used in many centers, and I think it's a fantastic method to give to determine which embryo for us to transfer. Okay, because some embryos may look like grade A embryos, but if you go through the time lapse growth from the time when you fertilize the egg, your day 1, day 2, day 3, day 4, day 5, the blastocyst, you see the whole thing, then you notice that some embryos were not separating, or rather growing as according to their proper timing. Then you know there's some problem with that particular embryo. So in my opinion, like, you have three main things: the endometrium testing, the genetic testing the embryo, and your time lapse. These three things are very important when it comes to improving your IVF success rate. The other thing would be like for sperms, to determine which sperms to use to do the intracytospecific sperm injection. For example, something called the microfluidic and your Zymot. Zymot is the brand name for that particular procedure, where it helps us to determine which the best sperms to use in terms of to fertilize the eggs. So with all these advancements in place, I'm sure that we can improve the overall success rate. But there's now what we need in future would be something even more like better compared to what we have now, in terms of egg stimulation, the better hormones, medication, or even, for example, to select the best sperm, and even better procedures to fertilize the eggs, and even lab techniques, SOPs, which can help improve the overall success rate eventually. In my opinion, every woman, irrespective whether they're planning to conceive or currently they're pregnant, all should get vaccinated, because the risk associated with vaccination is much lower compared to getting the disease. Because if you get vaccinated, the severity of disease is lesser, the probability of getting into ICU is much lesser, and probability of death or severe complications is much lesser, because you get a milder form of disease. Okay, now it comes to the certain issues about whether the vaccines are safe or not. We have been using vaccines for many years already, more than 100 years. Talk about tetanus, flu, pertussis, okay, diphtheria. A lot of these things, a lot of vaccinations has been used safely throughout the ages. So this is no different. So in my opinion, it's good to be vaccinated. The other one will be regarding your timing of vaccine and what duration of waiting, the interim period. Well, Certain guidelines in the world have mentioned 3 months, certain 1 month. Some of them, like certain countries have said that you can get vaccinated and do your fertility treatment simultaneously, which I quite agree with them because the vaccines will not disturb your hormonal profile. The vaccines will not trouble the injections. The will not have any side effects. Injections rather, okay, it won't affect the eggs, won't affect the sperms. So I think everybody should get vaccinated. More so in the certain studies such as come out in the UK. I think lately there was a BBC um, what do you call that article, okay, regarding vaccination and pregnancy. They've said that many women eventually got pregnant during that time when they were supposed to be vaccinated, during the just before vaccination, even after vaccination, and so far there are no problems with their babies. I don't think any of them have delivered yet, but because these vaccines are rather new. But so far they haven't found any adverse effects. But only thing they've seen is lesser severity disease, lower admissions in hospitals because of COVID. So, but but vaccines are only one method. The other methods like social distancing, hand cleanliness, wearing a mask, okay, these and avoid public areas. These things should also go hand in hand with the vaccines in order to reduce the overall spread of the disease. Well, COVID is going to be around for quite some time, so I think we all should be vaccinated as soon as possible.